The College of Medicine was built to be a first-class medical school from the very beginning. Our medical students come from lots of different backgrounds. But one thing they all have in common is at some point in their life they had this dream of being a physician. And this can transform their families, it transforms their communities, and transforms their patients. Making dreams come true for these physicians will result in a much better world for the patients they serve. Providing more opportunities for educating more physicians, we're allowing more dreams to come true.
This College of Medicine is not being complacent in their mission, bringing healthcare to areas that are underserved and that need it the most, training physicians that were service-oriented.
We have an opportunity to really change the healthcare landscape here. There's a lot of disparities that we have to deal with in terms of heart disease, obesity, diabetes, cancer. So we're very excited about really being instruments of change and being able to change the landscape and getting people work on prevention.
The College of Medicine is an integral part to the university as a whole to show and showcase what the university as a whole can do.
The University of Kentucky is this little gem that often goes underrated until you experience it.
It felt like home because of the sense of purpose you feel when you're here for the state.
When you walk around the halls and you interact with people and you realize that they are really trying to make a difference in the systems, they're trying to make a difference with their patients, they're trying to make a difference for the Commonwealth.
The great thing is that's always been the spirit of the College of Medicine, to be trailblazing and pioneers in all we do.
I look forward to our conversations about the people of the college and how they are living up to our foundational aspirations, where we've been, where we are now, where we're going to be in the future.
I have very deep roots in Kentucky. I'm an 8th generation Kentuckian. We came in soon after the state was established, soon after Daniel Boone, we always joke. So my dad, Dr. William Marksberry, was in the first medical school class at the College of Medicine when it was established. And that meant that there was no one ahead of him to teach him how to be a doctor other than the wonderful faculty that came that were the very first pioneers to start our College of Medicine. And it was a rich, very dedicated, highly talented group of people that he got to learn from.
So it was always about the training. Chandler Hospital got built to provide that training, and it's turned into this amazing academic health system that provides care all across the Commonwealth and beyond. That was our foundational mission, and we're able to provide it at such a higher scale than we ever had before.
But those bold ambitions have been true from the beginning. Dr. Carl Watson, who was in the first class of UK of the College of Medicine, and he was talking about how when he came for his med school interview, he interviewed in this red barn house that was in this barren cornfield, coming into a class of 40, interviewing in this very makeshift medical education building.
We're not that old of a medical school. We're only just a little over 60 years old. And so some of the giants from that area that established this school are wonderful. I came here in '88, so I got to see the tail end of a lot of these folks here. Bob Strauss was the first, developed the first department of behavioral science here.
Dr. Jacqueline Noonan was a pediatric cardiologist here and the one who discovered Noonan syndrome. These are the things that we learn about in our textbooks. I think from day one, the university has been committed to ensuring that its students can learn from trailblazers. And some of those are giant heroes.
But so many people have made so much progress. Emory Wilson, who's been the dean for 17 years here. Bill Marksberry, I got to know him and did residency with his daughter, Suzanne.
So my dad went away to do training as a neurologist and a neuropathologist. And because he loved Kentucky, he came back. And through commitment and collaboration and a lot of hard work, he helped develop the Center on Aging, which is a National Institute of Aging designated center and has been for over 30 years. So he really built the foundation of Alzheimer's research for our state as his passion. But I didn't realize at the time that I was watching him build that, how it would come back to help me be part of the way that we became a National Cancer Institute designated cancer center.
We stand on the shoulders of those that went before us. We'll always continue to do so, and it's built into our environment here in the College of Medicine. Made some significant contributions in many different areas from basic science to clinical science.
So I'm doing my PhD at the Blackburn Lab, where we use zebrafish cancer models to identify targets and treatments against different cancers such as leukemia. Collaborating and working with physicians and clinicians enable us to see the big picture of our research and hopefully translating our findings someday to improve patient outcomes.
I've never been in a healthcare system where they're so focused on not just the people of Kentucky, but physicians training from Kentucky, staying in Kentucky, and then getting out into all parts of Kentucky, serving the Commonwealth and getting healthcare to the Commonwealth.
Growing up in Costa Rica, I just really got to experience what it's like to live in an underserved area. You live in this constant feeling of like desperation. I really looked hard for schools that were not just academically rigorous, but had a commitment to pushing out physicians that wanted to invest into communities and to look for where the service was needed. And the UK Rural Physicians Leadership Program stood out like way more than others.
One of the things I've always appreciated about the College of Medicine is that it has truly had a pioneering spirit. So I remember when we started the Rural Physicians Leadership Program in Moorhead. I got to work with every one of those medical students as they came through. It was a number of years later that the Bowling Green campus came to be thinking about our inaugural class. I can remember on interview days just telling them, I promise you we're going to have a state-of-the-art facility. It's I would point and say, it's going to be right over there. It's still that pioneering spirit and mission that we need to do more. We can do more to reach more people across the state. And then the year after the Bowling Green campus, we opened our Northern Kentucky campus.
As we look at the health disparities that our state has, one of the only ways we can ameliorate that is by training more people to help serve. And then I fast forward to thinking about the conversations that we're currently having with the health education building. And so we go from this red barn house to thinking about this over 500,000 square foot building that's the future of the college in such a short period of time. Right? Those are bold ambitions for how we're going to educate students, for how we're going to advance healthcare in Kentucky.
We're going to be able to graduate an extra 50 positions a year, for example, with the health education, but maybe 75 even. And if each of them take care of 5,000 patients in their lifetime, that's 250,000 people that have a doctor now every year, because what we're doing there, that's what we're doing, that's the why. Training physicians specifically, but also scientists, that was our founding mission of the College of Medicine. We can never forget that, the North Star.
I'm proud of what has happened since I've been at the Cancer Center. Becoming an NCI-designated cancer center is not an easy thing to do. Becoming comprehensive cancer center, even harder. Took a lot of work, we did it. But I'm more proud of the legacy of my family in the College of Medicine, because my dad taught me how to be a good doctor. And I've gotten to be able to teach other people that. That's a really good thing.
We are expanding our regional campuses. We are growing partnerships across the state. We're building a new health education building. We're expanding research. All of those things are driven by our purpose, which is to create a healthier Kentucky.
So we've got to live up to the giants of the past, and we've got to be the best people we can be for the people that we're serving. And that includes people of the future and beyond. They count on us to be the giants of today. We are the university for Kentucky, and folks all around the Commonwealth, they look to us to be leaders, and we take that mission seriously. It makes me proud to be a part of it. I feel so privileged to be a part of this journey, to be the university and the College of Medicine for Kentucky.